Hello and welcome to My Dietitian Journey. I'm Felicia, owner and registered dietitian at Peraz Nutrition and My Dietitian Journey. Today I want to talk about how I typically structure follow-up sessions utilizing a case study example, and I hope that this will give you some ideas for working with your own patients. For my follow-up sessions, I generally block off 15, 30, or 60 minutes, depending on the patient. If it's their first follow-up, I usually block the hour. If it's a patient I've been working with for a while, I might block the hour. However, in some cases, I put them in 15 minutes or 30-minute blocks because this is what they end up utilizing. I have a lot of patients that I've met with and they're at work, and so we're only really seeing each other for 15 minutes or 30 at the most. So I don't want to block off the hour when I can have 15 or 30 minutes and then maybe schedule another patient. If I'm seeing a patient in the new year, I also make sure to send an updated demographics form so I can verify that the information I have on file is correct. This form includes their address, insurance information, and I make sure to verify that before they have that new appointment in the new year. Also, at the beginning of the new year, before I meet with the patient for a follow-up, I make sure that I have any needed referrals on file. The patient case study I'm going to utilize today is a 58-year-old male who's working from home full-time. They are married with no children. They have diabetes, hypertension, irritable bowel syndrome, anxiety, and depression. They also have an intolerance to lactose. This patient is taking multiple medications for blood pressure, diabetes, asthma, cholesterol, and also their mental health. They are a non-smoker. This patient is not a new follow-up, so this is actually a couple sessions in. So with follow-up sessions, I usually don't just jump right into checking in on their goals. The first thing I start with is a welcome and usually some kind of generic open-ended question like, how are you doing? If it was after the holidays or maybe the summertime, I might say something like, how are the holidays for you? Or how was your summer? Just something to engage and then build a little bit of rapport with the patient. Sometimes the patient will actually jump right into sharing about how their goals have been going. And in this patient case study, that's actually what they did. They jumped right into goal sharing and how things have been going. They had also been recently sick, so they also mentioned that they hadn't been doing much for tracking, which was something that we were talking about last session. The holidays were busy for them, which is true for many patients, so they didn't do much home cooking and they were eating more on the go. They also made it a point to say that this was out of the norm and they should be getting back to the goals that they set prior. Now, in this case, I specifically didn't check in on the goals that we set from last week because really it would have been redundant. So for patients who don't jump right into sharing their goals, I usually don't start with the question of, how was exercise for the week? First, I check in to see if the patient had any priority questions or topics for the session. I might say something like, before we move into anything else, I want to check and see if you have any particular questions or topic areas you would like to focus in on for today. Depending on what was covered last session, I might also check in to see if they had questions from that last appointment. For example, last session, we went over some information for IBS. I just wanted to check in to see if you had any questions about what we covered. If I sent resources, I might also ask if they received the resources and if they had any questions about anything that was sent. Now, my follow-up sessions are usually pretty flexible, but they do have some structure. I always start with rapport and engaging. Then I move into the patient chosen topic area if they voice it, and then I move into a check-in for the goals. The rest of the session is flexible, and this is based on the conversation. Usually I get an update on their eating habits, their exercise, doctor's appointments, and labs. Usually throughout the appointment, but always at the end, I talk about next steps and action items, which could be specific goals and then also scheduling. For this patient, since they had already started to talk about their eating routine, I really didn't need to specifically check in on the goals. I just listened and then reflected what I heard. During this initial part of the session, they shared about how they had been realizing that their planning was something that was lacking and they wanted to focus in on, and they were thinking about putting together some recipe ideas they can use. I reinforced this change talk in my response. I also offered an idea by saying that they can include some simple meal ideas. I said something like, that's a great idea. A lot of the patients that I work with like having a collection of recipes to go to, or even go to meal collections in a binder or a book, something like lentil pasta or frozen broccoli. When I mentioned frozen broccoli, this actually prompted a question from the patient about fresh versus frozen vegetables. This is actually pretty common that this happens during sessions where I make a statement or a suggestion, and this brings up a question or a topic area to dive in further. My go-to response about fresh versus frozen is something like, both are very comparable nutrition-wise. When they pick and then freeze the vegetables, it locks in that nutrition. One of the key things to keep in mind with frozen is to watch for anything with a sauce, which can have added sodium, fats, or sugar. A lot of times when I talk about fresh or frozen, the topic of convenience comes up. Usually this is an opportunity to highlight realistic goals and convenience with choosing healthy options. I also usually talk about how frozen options could be more accessible cost-wise and also reduce food waste. Using frozen can help with reducing prep time in the kitchen, which can make healthy eating feel less daunting. Sometimes when I'm providing patient education, or if a patient shares a topic that they want to know more about, I have a handout or a resource that might be helpful. I don't just automatically send anything, and I always make sure to confirm with the patient if the resource would be helpful. For example, with this patient, we were talking about some simple meal ideas, and I have a handout with meal combinations and swaps. So I said something like, you mentioned that simple meal ideas would be helpful. I do have a handout with some examples and some swaps. I can screen share, and you can let me know if it might be helpful for you. Usually, I just do a brief run through of what's on the handout, and then I check with the patient to see if they would like me to send them a copy. I might say something like, I will send you a follow-up email with the handout attached after our session for today. I'm going to make a quick note to myself so I don't forget. I always do this now so I don't forget to send anything, especially if I have back-to-back sessions. If I'm providing any education on a certain topic, let's say carbohydrates, I go over some information during the session, and then I usually check in with the patient to see if they want me to send any resources or information on the topic after the appointment. I might say, I do have some resources and websites I could send you that go over some of the information we talked about today. Would it be helpful to have those resources through email, or do you feel like you had enough information from what we covered in the appointment today? Depending on the conversation flow, usually in the beginning or the middle of the session, I talk about recent appointments and also labs. I might say, have you met with any healthcare providers between our sessions? If they had any appointments, I check to see if there were any medication changes or updates to their medical care. I also ask about recent labs. If they had labs done, I ask if they have a copy or access to the reports. If not, I request a copy from their physician. If the patient has a copy of their labs or has access to them, I usually ask them to go through some numbers like A1C, glucose, lipid panels, or anything else that might be relevant based on their medical condition and what we're working on in the appointments. Often I find patients are not getting any education from their healthcare provider on what their labs mean, like their A1C, or what's good or bad cholesterol numbers. If the patient has diabetes, I also check in on home testing. So I might say, have you had your blood sugar levels tested today? Or how have your blood sugar levels been at home? If they don't mention it, I also ask about any highs or lows that they've been experiencing. When it comes to following up on a patient's intake, usually at the first appointment, I'm getting a detailed food and nutrition history. This involves doing a 24-hour recall. For follow-up sessions, I do like to get an update on their eating habits. However, I get into this section of the appointment depending on what the patient has shared with their goals already. If the patient was not tracking, I might say something vague like, how have your eating habits been since our last appointment? If the patient is currently tracking and I have those logs, I usually bring those into the session conversation. I might say, thanks for sending over your logs ahead of time. I took a look through what you tracked, and I was curious if anything stood out to you after tracking for a week. If the patient had been tracking for a while, I might say something like, thanks for sending over your logs ahead of time. I took a look at the past few weeks, and before I comment on anything, I'm just curious to know if you noticed anything about your intake over the last few weeks. This gives the patient an opportunity to voice any concerns or highlights that they might have had with their eating habits. If the patient has been tracking for a while, or was new to tracking, I also check in to make sure that they want to continue with tracking. Sometimes this can feel really tedious and it can end up being triggering for some people. So I usually like to make sure that any tool that's being utilized is actually going to be helpful for the patient. So it's very individualized. Depending on the patient, I will bring up the topic of physical activity in a few ways. If this is a patient I'm working with and they don't have a specific exercise goal, and I know from their initial appointment that they're sedentary, I usually say, has there been any change in the amount of movement throughout the day for you? Usually this is something vague. This patient in particular was not currently active and was also recently sick. The focus for our session was also not on exercise, but eating habits first. So I didn't push towards any kind of exercise goal at this stage. If a patient did have an exercise goal or they were already physically active, I might check in on their goal by saying, how was exercise since the last time we met? Or last time we met, you mentioned you wanted to try and add in some walking throughout the week. How has that been going? If going well, we might talk about a next step in the goal setting to keep everything moving in a forward direction. If it's not going well, I usually spend time troubleshooting with the patient. Was it the time of year, weather, motivation? Sometimes I even put a pause on a goal for the time being because the patient may not be ready to implement it just yet. Then we brainstorm some options and maybe explore motivation in the meantime. Now, weight can be a very triggering topic for a patient, and usually I don't bring it up in the session unless the patient specifically wants to focus on weight loss. Even with that, I don't like to overly focus in on weight since there's a lot of factors that can influence weight, and depending on the goal progress, they may not have been implementing any changes that would even influence their weight loss. So sometimes the patient ends up hyper-focusing on the weight, and then it undermines their healthy eating habits. So with that, if I bring up weight in the conversation, I might say, any changes that you've noticed to your weight between our sessions. If the patient had any weight loss, I don't do anything like congratulations, but just basically collect the data. I might also say, how do you feel about your weight loss so far? If a patient expresses some frustration with minimal loss or not losing at all, I take this opportunity to go over realistic weight goals and also put in perspective what influences weight and where they are now with the process. I make sure to also validate what they're feeling too. With creating a plan or goals, a lot of times these are brought up in the conversation throughout the session. Usually I reflect on any change talk or goals that I hear and also take note of them to then touch base on them more formally at the end of the appointment. With this patient, action items were actually brought up a few times, so I provided a brief summary. I said something like, you mentioned planning as kind of being an overarching goal with some steps, looking at recipes and some meal ideas. You also mentioned with planning, you were going to buy less in bulk because it was something that you were finding that you were getting too many items and then you were throwing away food. I know you said you wanted to do some grocery shopping for the week and then look at some different product options that you might want to try. Anything else you feel is important to focus on between our sessions? I always end with a question in the event that I miss something. If goal setting wasn't as obvious during the appointment, I might say something like, based on what we talked about today, what do you feel like could be a next step or an action that you could take between the sessions? With any goals, I always explore barriers so we can increase the likelihood of success. At this point in the session, usually we're close to time, so I might say something like, we are just at about time for today, but I wanted to check in to see if you had any other questions or concerns that we did not get to today. If we haven't reached the time limit for the session, but the session is kind of winding down, I usually provide a brief recap of what we talked about so far, and then I ask the patient if they wanted to cover anything else. I might say, so we went over some next steps, and then I highlight what those are. Are there any other topics or concerns you wanted to make sure that we covered for today, or questions that we haven't gotten to yet? If we move into another topic, I usually do another check-in before closing. Something like, well, it sounds like we have a plan in place. Was there anything else you wanted to go over for today, or did you want to look at scheduling? If there's no questions or concerns, then I move into scheduling. Usually with follow-ups, if a patient is newer to the practice, I might see them every 2 to 4 weeks. If they have a limitation on insurance coverage, it might be more bi-monthly that I might be seeing them. I take this time to also review how many visits a patient has left in the year and if there's any limitations to those appointments. At the very end of the session, I confirm the appointment date and time and also send the appointment notice while I'm on with the patient. I also reconfirm the goals and or their next steps before I close out the appointment. So I hope that this was helpful in hearing about my approach to a follow-up session with a patient. Thanks so much for listening, and reach out if you have any questions.